this video, I want to talk about some of the common gut health mistakes that people make and how you can avoid making them during the protocol, but also keeping these things in mind for after your protocol. So the first is a SAD diet, or the standard American diet. And this diet you're probably familiar with. It includes processed foods, artificial food dyes and flavorings, GMO ingredients, pesticides and chemicals, poor quality oils, non-natural additives and preservatives. All of these things are common in the typical American diet, and all of them have a negative impact on gut health. So they can impair the function of your digestive enzymes, which prevents your body from breaking down food well and absorbing all the nutrients that it needs. Can contribute to leaky gut, which, as Dr. Beard has articulated, contributes to inflammation all over the body. It can overwhelm your body's detox abilities. It can be harmful to your beneficial bacteria. It's basically poison, which is the note that Dr. Beard put in here, poison. So we want to avoid these things in our food. We want to focus on eating real whole food with quality ingredients. The next thing that can be an issue for gut health is excessive sugar in all of its forms. So when we think of sugar, we often think of pies and candy and soda, but it can also be those like simple carbs from breads and crackers and chips. It can also be the gluten-free and vegan processed foods that are out there. Just because it says gluten-free or vegan doesn't mean it's healthy and doesn't mean it doesn't have sugar. So you have to keep those things in mind and pay attention to the labels. Really, if it has a label, it's probably not as good as something that doesn't have a label. And really what excessive sugar does is it can increase your risk for yeast overgrowth in the gut. Yeast loves to eat sugar, and so it can grow out of control and contribute to health issues. It can also contribute to blood sugar imbalances, and that's going to contribute to hormone issues. Obviously, it's going to increase inflammation in the body. And like I mentioned, weight and hormonal issues are typically downstream from excessive sugar intake. Artificial sweeteners, those also can be an issue for gut health. They actually increase your risk for weight gain, metabolic syndrome, type 2 diabetes, and cardiovascular disease. There really shouldn't be a place in your diet for artificial sweeteners. What they do is they trick your brain into increasing insulin and the fat storage hormone, which increases belly fat, but also just has all of the hormonal impacts that sugar would have. Because really, your brain thinks you're eating sugar. And so it's going to respond in the same way that it would as if you were eating sugar. And so you can't really get away from eating. Just because that doesn't have calories doesn't mean it's still not impacting the physiological functions of your body. And artificial sweeteners are highly addictive. They can be thousands of times sweeter than actual sugar. And so it's hard to get off of them once you're on them. And so it's important to wean off of them or cut them cold turkey. But also, when you're eating them, you can have a harder time enjoying the foods that are naturally sweet, like fruits and vegetables. So really want you to limit real sugar and artificial sweeteners. And then while you're on the protocol, cheating on the diet can be a really common mistake. Our motto is do it once, do it right. You don't want to have to do this again. It's really only something you want to have to do once. And the reason that you want to stay compliant is that one single bite of food that you're sensitive to can set off an immune response that lasts up to 120 days. So we want you to be successful in figuring out, are there foods that you're sensitive to? Are there foods that are contributing to how you're feeling? And the only way that we can really do that is if you stay compliant. That's going to help you be successful here. Alcohol can also be an issue for gut health. So while you're on the protocol, you won't be having alcohol, but keep this in mind as you transition back into your day-to-day diet. It can directly harm your beneficial gut bacteria, and it can use up your body's glutathione stores. And glutathione is your body's master antioxidant, and it's important for detox, but also it's important for making sure your body repairs itself well. And then it doesn't matter the form, although there is some research that red wine may not cause quite as many issues. But Again, really want you to avoid alcohol during the protocol, and then afterwards, just be cognizant of the impact that alcohol can have on the body. Some medications. And so if you've been on these medications or you've had a history of them, just keep this in mind that we may have some work to do on your gut health if you've used these medications in the past or are currently on them. NSAIDs like ibuprofen, these can increase your intestinal permeability or leaky gut, and even just 1 to 2 doses can have an impact on intestinal permeability. And so what that does, like Dr. Beard has kind of mentioned in the videos, when your gut is more permeable, that cheesecloth, those tight junctions kind of start to come apart and more particles can get through the gut and activate your immune system on the other side, causing inflammation by your gut and then also throughout the body. And so this can contribute to a vicious cycle of inflammation. If you take an NSAID for joint pain and then all of a sudden your intestine is more leaky, then what happens is you activate that immune system and you get more inflammation in the body and more inflammation in the joints, and so more pain in the joints. So you want to take another NSAID. So as much as we can stop that cycle, we want to do that. So if you can get off of these, please, please, please don't take these. And then the other medication that we want you to consider weaning off of if you're currently taking, or just being aware of if you've taken in the past, is an acid suppressing medication or a proton pump inhibitor. These are typically taken for heartburn. And what they do is they disrupt the digestive enzyme function by altering your stomach pH. Digestive enzymes like to work in a specific pH range in your stomach. And so if there's not enough stomach acid in your stomach, those enzymes won't get activated. They won't break down your food the way they're supposed to. And this can have an impact on the way food's broken down, and also it can impact the whole rest of your digestive tract downstream from there. And so we've provided a tapering off of PPI handout in the Facebook group. So if you need to try and taper off of these now, we've provided a handout for you with instructions on how you can do that. If you need additional support, you can also always reach out to us and we can walk you through how to do that well. It's also important to note that heartburn can be a symptom of too much or too little stomach acid. So most of the time we just assume heartburn, too much stomach acid, take an acid suppressing medication. But that's not always the case. Sometimes it's not having enough. And so we can help you test. If you're struggling with heartburn, we can help you test to see if you have too much or too little. And it's really simple and it's at home, and it doesn't require any laboratory work or anything. But if you have struggled with heartburn in the past, I'd encourage you to start the elimination diet and the protocol and just see how you're doing. You may find that it starts to diminish and even go away on its own. If not, again, we can always provide support for you during this process. And then obviously antibiotics are going to have an impact on gut health. Even one course can wipe out much of the good bacteria in your gut. And so sometimes they are absolutely necessary and you need them. So that's okay. But really you only want to use them when they're necessary. You don't want to use them for a cold because most colds are caused by viruses. So if you've been the person that just likes to get over something fast and you think that an antibiotic will help, so you ask for one, please don't do that anymore. You really should only use antibiotics for serious bacterial infections. And Dr. Beard has seen many patients experiencing health issues after antibiotic use. And sometimes they can be kind of the trigger for what sets someone off. So again, only use if absolutely necessary. The bottom line from all of this is we want you guys to make educated and empowered choices starting today that will impact your gut health for the better. And so we also want you to keep these things in mind moving forward after the total gut job. Some of these things will be taken care of while you're just chugging along on the protocol and diet. But as you transition back out, choose the things that are going to support your gut health long term, and that'll support your health long term.